Uh, Following a floral tribute to Dr. Sunil Pandya, we shall begin this condolence meeting with a Guru Vandana. Our salutations to our revered teacher, Guru Dr. Sunil Pandya. The first recital is from the Jnaneshwari, chapter 1, verse 1, followed by a second recital from the 58th verse of the Guru Gita.
Om Namo Jiyadya Veda Pratipadya Jaya Jaya Swasamvedya Atmarupa Deva Tuchi Ganeshu सकल मति प्रकाश मन निवृत्ति दासु अवधारी जोजे ओम नमो जिया ओम नमो जिया ओम नमो जिया
गुरु ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरु साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः
ओम शांति
शांति शांति
ओम शांति 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 ओम शांति शांति शांति
I request the audience to stand and observe 1 minute of silence in remembrance of Dr. Sunil Pandya. You can be seated. We have gathered here today to condole the passing of Dr. Sunil Kumar Krishnalal Pandya on 17 December 2024. Dr. Pandya was the ex-head of Department of Neurosurgery, KM Hospital and St. GS Medical College, Mumbai, and ex-chair of Medical Humanities at St. GS Medical College. The Department of Neurosurgery of KM Hospital and St. GS Medical College extends its deep condolences to his family, colleagues, students, admirers, and followers present here today and all over the world. We pray to Almighty to grant the departed soul peace and solace and strength to all those affected to bear this loss. Each one of us is experiencing a flood of fond memories and unforgettable anecdotes that we have shared with Dr. Pandya. Dr. Sunil Kumar Krishnalal Pandya was born in Santa Cruz West on 11th February 1940. He was an alumnus of Grant Medical College and Sir J.J. Group of Hospitals, Mumbai, where he obtained his MBBS in 1961 and MS General Surgery in 1965. His neurosurgical training was under the guidance and supervision of Dr. Gajendra Singh at JJ Hospital and Dr. Homi Dastur at KM Hospital. In 1974 and 75, he pursued further specialty training in the Institute of Neurology and in the Institute of Child Health at Great Ormond Street, both at London, as a Commonwealth medical scholar. He had benefited greatly from his visits to the departments of professors like Mohammad Yasar Gill, Samay, Sujita, and others. He owed his interest in the history of medicine to Dr. Ashok Vaidya of KM Hospital and Dr. Samuel Aptekar at GT Hospital, Mumbai. For several years, Dr. Pandya had addressed the first MBBS batch in our college on history of anatomy. He has published several papers in scientific journals as well as popular press on neurosurgery, history of medicine, and issues pertaining to ethics. He was the emeritus editor of Indian Journal of Medical Ethics and served on editorial boards of National Medical Journal of India and Men's Sana monographs. I was fortunate to be Dr. Pandya's student when I joined my MCH neurosurgery course. Dr. Pandya's association has impacted my career as well as my personal life. I vividly remember my first encounter with Dr. Pandya, a distinguished, tall, balded man, all in white, walking erect, and at a fast pace difficult to match, outspoken, and having an infectious smile. His aura was unique and unmatched. The list of words to describe Dr. Pandya are endless. Those coming upmost in my thoughts are simple, polite, disciplinarian, punctual, hardworking, strict taskmaster, compassionate, and sometimes obstinate. His eyebrows spoke more than his words. His expression of anger or displeasure were his elevated eyebrows. The dedication and courage required to be a neurosurgeon was imbibed from him to his students. Honesty in patient management was a hallmark of his clinical teaching. I've humbly tried to emulate all that I've learned from Sir and try to pass on these teachings to the next generations. Dr. Sunil Pandya has been solely responsible to take the Department of Neurosurgery to great heights based on foundations laid by his teacher, Dr. Homi Dastur. The Department of Neurosurgery at KM Hospital is not only well known in India, but also around the world for its high standards of patient record keeping, management of complex cases, and training of skilled neurosurgeons. I was with Sir during the last decade of his professional life at KEM, during which he had significantly mellowed down. Even after retirement, Sir kept in touch and provided guidance to me. I'm going to sorely miss him and personally pray that we continue to practice all that Sir has taught us and make him proud. In addition to neurosurgery, medical ethics and humanities were close to Dr. Pandya. He set forth the Forum for Medical Ethics and a respected journal, the Indian Journal of Medical Ethics, and these deliberations have led to the formation of the Department of Medical Humanities at said GSMC. I quote Abraham Verghese, a well-known American physician and writer. Sunil Pandya was truly a Renaissance man, combining his skills in neurosurgery with a broad interest in the humanities and arts, and all of this combined with a tremendous love and commitment to the institution where he trained and to his colleagues and students. Any one of us would be proud to have made the kinds of contributions that impacted so many in one lifetime, I unquote. I further quote Amar Jasani, editor of Indian Journal of Medical Ethics, who has described Dr. Pandya as follows. I quote, he's taller than other great clinicians and scientists because of three additional virtues in his character. First and foremost is his commitment to ethical medical practice. He doesn't like to preach what he doesn't practice. The second characteristic is his constant effort to look beyond the narrow discipline of clinical medicine to the fields of medical history and bioethics. The third characteristic is that he says what he considers as right. He is never afraid of how he will be received or perceived by the audience. To summarize, Dr. Pandya has been a reformer of medical practice and services. We have been blessed to have a legend called Sunil Kumar Pandya in our lives. Dr. Pandya, you will be greatly missed. I pray that you will continue to inspire all of us and future generations to emulate your teachings. We can never say goodbye to you, sir. You shall be with us forever. I now invite Dr. Sangeeta Rawat, Dean, St. G.S. Medical College and KM Hospital, to address this meeting.
Good afternoon, all. And we deeply mourn the loss of Dr. Sunil Pandya. Nadkarni has already said all his details, where he trained and all. But so I thought I should speak my interactions with him. So it started when I joined as MBBS. I just remember two distinct people. One, like Dr. Pandya, who would walk with, white clothes and tall and erect. So I used to really get impressed. Other was Dr. Rupinsha, who used to wear a long apron. And, both of them I distinctly remember as MBBS student. And then way back in 1989, I joined as a DM neurology students. And that's when I came in close contact with Sir. I still remember as DM resident, we used to tremble when we had to go and ask him for something. The way he used to deal with the radiology, the way he used to have attended some of his things, I mean, he was par excellence a radiologist also. The way he would analyze the brain MRI, I mean, CT scan and everything, what that time was, it was superb. So that was a great learning. And also, whenever in the neurology department, we had a patient who has come for follow-up and we don't know what has happened in past, would always go to the neurosurgery department because he had an excellent record keeping. I don't think so I've seen anybody having such excellent record keeping where each and every, his handwritings were beautiful. And in his own handwriting, we would be able to read his notes and get all the details of that patient, which it may be in the form of a investigation, in the form of a surgical notes, everything will be there. And that would give us be a great help to us as a neurologist to follow up those patients. So definitely, I spent all my life in neurology department after 89, and we had several occasions we had met. And then later on, when I became a lecturer and I became associate professor, he used to really give a respect. Sangeeta, would you come and see this patient and give your opinion? If someone says such tall, such person who with such a great knowledge tells you something like this, it really gives you a great satisfaction that yes, someone is giving me so much respect. Then came the day when I had never thought that I'll become a dean, but the day I became dean, after a week or 10 days, when he had started this, medical humanities department, and he said, Sangeeta, we would like to come and meet you. So, sir, I said, sir, I would come and meet you. He said, no, I will come to your chamber with my team. So he, Dr. Rami, Dr. Ravi Ramakan, Dr. Padmaja, they all came. First thing which I did was to take his blessings, because blessings of such person is immense. By the time I became dean, my dad was no more there, but he was someone whom I really respected and loved. So once then he said ki, what all they want. And I think one thing which he asked me that we need a place for medical humanities. And I said, sir, the new building which is coming up, I will surely give you place over there. And I think that will be my real tribute to or real homage to him, that I give a place into the Centenary Tower 1, which is coming up to the medical ethics department. And I'm sure if within my tenure it comes up, I will definitely try and do it. And even if my tenure is not there, I will write that this floor and this area belongs to medical humanities. And I'm sure that will be my real tribute to him. And the way he came with the stick with walking, but he had so much enthusiasm that this medical ethics, it should be started. And he said, in India, there is hardly any hospital or a college where this departments are existing. And all over world, I think Gosumec Foundation, everywhere he has been respected for this, that medical ethics and humanities that which he has started, and the way the talk, the lectures are being held, orations are being held under that leadership was too good. And I think the ethics and was there in his blood. Anybody who will go near him would be, feel that aura in him. And I still remember the sentence he told me that, Sangeeta, I am very happy that you have become the dean. I said, why, sir? Because I know you will be like me, ethical. I said, thank you so much. You have that much faith in me. Because he said, I know your family, I know your father, and I know what you will be doing will be for our alma mater. And that's what I think I want to do for my alma mater. I used to meet Madam Pandya also sometimes, because electrophysiology was we all had to learn. I used to go with Kushnuma to Madam's clinic at Bombay Hospital sometimes, and I remember she was also so strict about everything. But I think that made us a better electrophysiologist, a better neurologist for life. So I think what is written here, he was an ethical person, he was a guru, he was a teacher par excellence, he was an excellent human being, and he was a mentor to so many students and so many neurologists and neurosurgeons like us. I just had a letter from Raj Bayani day before when I was out of India, and the way he was describing Dr. Pandya, and he said that he has changed so many neurosurgeons' life. And I think that everybody will vouch here that his teachings have trained so many neurosurgeons, and that's why our departments are having such heights. So with this, I say that may his soul rest in peace, and his family gets the his, and we all of us get his blessings forever, and we could live up to some extent to his teachings in our life. Thank you very much.
Request Dr. Lopa Mehta to say a few.
All the friends of Dr. Sunil Pandya. An era has come to an end. We have lost someone who was medical ethics personified, an astute clinician, a dexterous neurosurgeon, an ardent historian, a philosopher who stood high above worldly gains, name, and fame. He lived as a well-wisher of his patients, friends, family in particular, mankind in general. In this very theater, he kept students on the edge of their benches by telling fascinating stories on the history of anatomy, which included the theft of bodies from the graveyard. In 1993, when serial bomb blast shook Mumbai, his talk was going on. Nobody paid any attention to the sound of the blast, dismissing the noise as the bursting of crackers. We realized the gravity of the sounds only when a messenger from Dean's office asked us to stop and go home. And mind you, the lecture was completed subsequently. Janus, the archives, pride of our institution, is the brainchild of Dr. Sunil Pandya. He preserved very carefully the old books of 18th century from the library, which had outlived their lives as per the library requirements. He preserved the neurosurgery instruments of Dr. Ginde. Current residents cannot recognize those instruments. Since 1993, when he was instrumental in setting up of archive till today, he has donated his personal books to enrich our collection. The last lot reached the institution on the day of his passing away. He shaped this division of medical humanities and gave it a structure. He truly worked as a chair for medical humanities. He was a very close friend of Dr. Manu Kothari, and that's why he said he had accepted that position. The division carried out various multifaceted programs, including the conference Ascension, an annual event which is usually organized by students, and publication of the annual report, as well as bringing out a volume on the theme of medical humanities. He had vision. He relinquished his post in April 2024 because of his failing health. His contribution as the chairperson of Dr. Manu.V.L.Kothari remains unparalleled. He guided the students and staff how to go about their work. Though he did not visit the institution physically, he worked daily a couple of hours on medical humanities. He collected enormous material on medical humanities, and we have a rich collection of the same. Mind you, this entire selfless work was done without accepting any honorarium. I have known him since 1970. He stood by Dr. Manu Kothari and myself in various capacities. He encouraged us in our lateral thinking in medicine. He acted as a true peer of all our writings. We used to have endless discussions on medical philosophy. Personally, he came to my rescue after a sudden passing away of Dr. Manu Kothari. He encouraged me and spent an enormous amount of time towards completing and publishing our 7 books and also the new editions of 4 of our books. He also helped me in writing medical articles for international journals. Dr. Pandya believed he was an atheist. In conclusion, I am reminded of an episode from The Keys of Kingdom by A.J. Cronin, in which Father Sizom tells his friend, a non-believer, that although he may not believe in God, God did believe in him. Thank you.
Dr. Lakshmi Vasudevan wanted to say a few words.
I look odd in this place. Before I start, I would like to say I would like to recite a mantra which goes like this. Om Haum Jum Saha, Om Bhur Bhuva Swaha, Om Trayambagam Yajamahe, Sugandhim Pushtim Vardhanam, Urvaruham Bandhanat, Mrityur Murchi, Dr. Pandya Yamamritad. Oh Lord Shiva, take me from this world of mortality. Take my professor, Dr. Pandya, from this world of mortality to immortality. Until yesterday, I was in huge pain since I came to know of his death. But yesterday, I mellowed down. I became softer. I calmed myself. You know why? Because I read Adi Shankaracharya's Nirvana Shatakam, which says, Aham Brahmasmi, Tat Tvamasi. I am consciousness. I am not this body. I am not my hand. I am not food. I am not Prithvi. I am not Akash, I am not water. I have no friends. I have no enemies. I am that. Aham Shivo Aham. I am the supreme consciousness. And I think, sir, is that supreme consciousness. God always comes, God has no form. He comes only in the form of humans or other living beings. So I feel God has descended on this earth as Dr. S.K. Pandya. And we were all lucky to have been associated with him. Now let me come to how I knew sir. I passed my first MBBS in 1968, December, and we had our first junior clinic surgery under the very young Dr. S.K. Pandya. He had just joined the department a year before, and we were posted under him for 6 weeks. He taught us. So initially, we thought we are in neurosurgery department, but he taught us entire Kedas, chapter by chapter, during those 6 weeks. During those 6 weeks, I learned from him how to take history, and he was our Harishri of surgical learning. And he taught us how to take patiently history taking, examination, maintaining proper notes, and how to come to diagnosis. So that was the first in the initial first 6 weeks. And thereafter, during my undergraduate days, he became my role model. I thought if I had been a male, I would have become a neurosurgeon. But since I'm a girl, I thought this branch is too much for me, because I saw him sitting for 8 to 10 hours doing operation in the operation theater. Even those days, he took us to the operation theater. He showed us craniotomy, trephining the burr hole to remove the subdural clot. So from then onwards, he became my role model. And thereafter, in first MBBS, we didn't have to do any neurosurgical term, as you all know. But I did meet him. I did approach him for twice for help. Once was for my cousin who had a abscess in the neck region. So it was diagnosed as tuberculosis, but then suddenly he developed severe neck stiffness when I brought him to KEM to show him, and he diagnosed that this is cirrhosis. This is tuberculosis of C2, and we have to be very careful and has to be treated immediately. And he put him on traction and immobilization. The next was within those 4 years, there was another child whom we knew. She had symptoms of cerebellar tumor. So when I brought that girl, sir was kind enough. He diagnosed and he admitted and took care of the child. That was during my undergraduate days. After that, I joined post-graduation for pediatrics. And I was under Dr. S.M. Merchant, and sir would send from Vadia, children whom he thought had some neurological problems, which could not be diagnosed there. So I would bring these children to KEM for sir to see. And sir would take time, examine the children, and he will give his a diagnosis, or he would admit them. And while doing post-graduation in pediatrics, I met sir in the corridor, and I told sir, I'm giving up my studies. I'm getting married and going away. So that was the first time he admonished me. He said, no, don't give up your postgraduate seat. You will regret later in life. But I didn't listen to him. I got married, went to Delhi. Fortunately, I came back. And fortunately, whatever the reason is, I came back. And I completed my MD pediatrics, staying in the Department of Anatomy as anatomy lecturer. So during those days, sir would come to anatomy department regularly to meet Dr.M.V.L.Kothari. Both of them were birds of the same feather. Both of them were simple, very wore khadi white dress. Both were philosophical. So they formed a good pair. And during anatomy days, sir would give regular yearly lecture to undergraduate students on history of medicine and history of anatomy for nearly 2 hours, not 1 hour, 2 hours, without taking a sip of water. And that he continued, I suppose, for about 30 or 40 years. So that was during my interaction with him during anatomy days. And later, after that, I attended his send-off party, and it was a send-off party by his department as well as by the college. By the, so and after that, since I left KM, I didn't have much. I didn't meet him much, except rarely in the Department of Medical Humanities once or twice. By the time Sir had grown old, and so these remembrances of Sir. Well, I forgot to mention that when I was doing my MS Anatomy, my dissertation was on craniovertebral anomalies. So where else do I do get cases for craniovertebral anomalies? Madam referred me to Dr. Pandya. I used to go every afternoon, sit with him and see cases. I got about 50 cases. Some of them were retrospective, some of them were prospective. And those days we didn't have MRI or CT scan. And I would dig out the X-rays and mainly X-rays. And he would teach me how to measure the millimeter differences to make a diagnosis of dislocation of atlas or basilar invagination or increased basal angle or Arnold shearing malformation. So for about 6 months, I was sitting with him in the afternoon in his OPD and learning. And he taught me, like, he held my hand, so to say, and taught me those cases. So I can never forget him, and he will ever remain in my mind. And I'm sure such people do not come to earth. After all, God? God is one who gives, and God needs a body, and God comes on and off and on, and in such great forms. So no wonder we say Mata Pita Guru Devam. So I found my God in him. I saw it, and thank you.
Dr. Ravi Ramakantan. Dr. Pandya and I have been in the habit of exchanging mails often and phone calls occasionally. The last mail, which came in response to something I wrote, was on October 26th, in which he wrote, your affection and words of counsel have been really heartwarming. That is the last sentence I heard from my guru. And what more can I ask for? I will not go into the past. The past is gone. Today will also go. We have to look at the future of how we can make this man immortal in the hallways of our hospital and the college. And I have some suggestions for that. The first is based on a phone call, a Sunday morning phone call that I got from him about 6 or 8 months back, maybe even 1 year. And he used very strange words, which is not something native to him. He started with, Ravi, you should do this. And he said that you know how much I respect Dr. Homi Dastur, and I want the Department of Neurosurgery to be named after him. And he continued and said, Ravi, you know how the functioning of the BMC is. I don't care what you do, but you make it happen. So that was the tone of his phone call. I told him I cannot do it. It has to be initiated by the head of the department. And I talked to Adil at that time. And I lost track of what that happened. Dean ma'am, this was his passionate request. And he said, and we know that there are other departments in the hospital which have been named after people. And therefore, on his behalf and behalf of maybe everybody else here who has worked with him, I request you to help us to name this department as Homi Dastur Department of Neurosurgery. Any paperwork you want us to do, we will do it. We'll initiate. I mean, I'll be an outsider,
but I am the news bearer, if you want to call it that. And he told me in passionate words on that Sunday mornings, words which he never uses. Ravi, you see that it is done. That's one thing. The second thing is about all of us know that Sunil Pandya was a champion of medical ethics. It's so heartwarming to hear the dean say that she is going to allot that space for medical humanities. And more than that, it is so very thoughtful of you to say that if she is not here as the dean, she will make sure that the next dean does that. I mean, that would be the true tribute to Dr. Sunil Pandya. Dr. Sunil Pandya was a man of history. He dug into everything. He has written a volume on the roads of the city of Bombay that have been named after after medical doctors. He always dug into history. The history of GS Medical College that he has written about, all of that reflects a man who is interested in the past. And we have this wonderful archives here called Janus by Dr. Manu Kothari. And it is my personal request, this is on the top of my so-called brain, that we call that archives as Sunil Pandya Memorial Archives, the Janus. Ma'am, this is something in your hand, just in your hand. You can go to your office and make this happen today. And my request to you is this would be a permanent tribute to the man who dug his heels, not literally or figuratively, a man who was so interested in the past. These are the three things that I feel very passionate about. The fourth thing is something some of you may feel squeamy about, some of you may feel I'm insensitive, but having worked with Dr. Pandya closely in medicine and beyond medicine, I request permission from whoever is here and also from the family that we preserve his brain in a jar and keep it in the anatomy museum. If all of you agree, if the family agrees, we can even label it as the brain of a neurosurgeon. This is more for sentimental reason. People will come and ask, whose brain is this? Who is this neurosurgeon who has donated his body for medical research? So I feel that that can be done. I talked to a few people. I think it is still possible to take out his brain and preserve it, but we'll have to take permission from the family for doing that. And the last thing is something more. The reason Dr. Pandya donated his body, that for dissection is a part of it. I agree to that. But it is for the furtherance of medical education, medical knowledge. All of you know that he suffered from psoriasis for many decades, and his final end came because of pulmonary involvement due to interstitial lung disease. So it's also possible for us to learn from his remains so much about the pathology of psoriasis in ways which has never been described. For example, I mean, I don't want to get into details, it's not appropriate, but that can also be done. We have to discuss with the family, we have to discuss with the concerned specialist here if that can be done rather than just do dissection of his body. That's all I wanted to say. Thank you very much.
Now request Dr. Anil Karapurkar to address the gathering.
Thank you, Dr. Nadkarni, Dean Madam. Much has already been said by everyone about Dr. Pandya's accomplishments. He was my colleague from 1972 when I joined as a houseman. Let me also, since it has not been mentioned, say that when he was a medical student, as a medical student, he had won 6 scholarships and 3 gold medals. And when doing internship, instead of doing 3 months of gynec, he did 3 months of neurosurgery. So that was his interest right from internship. And he had a very good mentor in Professor Gajendra Singh at JJ Hospital. And he joined KEM in 1967, as was mentioned. And when I joined in 1972, I used to see him sitting with X-rays. He would put up X-rays. If the X-rays were of interest, he would label them and keep them. If not of interest, he would throw them. And I asked him, whose are these? So these were X-rays from Dr. Ginde's time. Ginde was the one who had started the Department of Neurosurgery, but after 2 years, he had to leave for some reason. But he had left all his records there. And later, of course, Dr. Ginde's family donated all his, he had a whole big collection of books. He had X-rays. He was also very meticulous in his notes, which Dr. Pandya, of course, had worked with him for some time in JJ Hospital also. So he had imbibed everything. So this is one aspect which I wanted to talk about. For especially the youngsters, I think his contribution to this institution also you should know. When in neurosurgery, we have always had the best of equipment. We've always had original imported equipment, which not even Bombay Hospital, the leading private hospital at that time, had. Like we had the original operation tables, the original lights, the original drills, the original instruments from Downs, from Isculap. Everything was, so we had the Clavard set, we had the spine set. Everything was, of course, he had a very good rapport with the dean. So we were able to get everything. Dr. Goel will remember that we had got even the endoscope long ago. When he returned, when he was in England, he trained with George Duboulay, who was a neurosurgeon. But there he met the radiologists, James Bull and Brian Kendall. Brian Kendall used to do intervention. So from him, he got interested in intervention, and he prevailed upon Brian Kendall and James Bull to donate catheters and wires. When he came back to India in 1976, that is how we started doing transfemoral. So that was the first institution here in the country to do transfemoral. Dr. Pandya had started it. And we didn't know how to do it. We were doing percutaneous punctures in the neck. He got Dr. Tayyab Ali, who was a radiologist at Breach Candy, to come and teach us how to do transfemoral angiography. So that's how we started transfemoral angiography in 1976. Another thing which would be of interest, I think she mentioned that we used to do ventriculography and myelography, and there was no CT scan in those days. So we had to imagine where the tumor was. There was a Dr. R.D. Ganatra and Dr. Aban Samuel at the Radiation Medicine Center in Tata Memorial Hospital. They said we can do isotope brain scans and you will be able to locate your tumors better. So he collaborated with Aban Samuel and R.D. Ganatra, and we used to go once a week for these meetings. And they started doing, so all our patients from KM used to trek, this is in the 70s, before the CT scan came. And many times we were able to see tumors, brain abscesses, tuberculomas. Each one had a different appearance on the isotope scan. So for many years we were doing that. Then I forgot what I wanted to say. Let me start my phone and refresh what I wanted to say. As has been mentioned, he has always had a very good rapport with the other departments. So for instance, the spine surgery department was set up primarily, of course, Dr. Lahiri is here, but the spine surgery department was primarily set up because of him. He had managed to get donations. The ICU, we had a neuro ICU. We were looking for a neuro ICU. Dr. Pandya managed to get some big sum as a donation. But later he realized that rather than have it confined to the neuro department, it would be much better to have it as a general department. So he requested Dr. Dilip Karna to take over. So actually, the medical ICU was funded and supported and came into being because of Sunil Pandya. Dr. Nilima Shirsagar was a clinical pharmacologist. So she wanted to, at that time we had the only antifungal available was amphotericin. And systemic and amphotericin used to have a lot of toxicity, hepatic, renal, patients used to get chills. So, Shivsagar suggested that we try liposomal tagged amphotericin. So in fact, they set up a research lab in the clinical pharmacology department here. Again, Dr. Pandya strongly supported them. And the first patients in whom they were tried were our patients. So it was very effective in aspergillosis and mucormycosis. So the first few patients of liposomal tagged amphotericin were treated in the 90s by us at KM. Of course, as Dr. Lopa mentioned, he had a very good rapport with the anatomy department and he used to give those lectures to the anatomy department. So it's not only himself, but other departments also which he supported. In our own department, when transplant surgery was started in the 78, Ernest Grote had from Germany, Gießen had come, and he showed how transplant surgery for pituitary tumor is done. He said, you can come to Germany and I'll teach you how to do it. So rather than going himself, he deputed Dr. Nagpal. Dr. Nagpal went there on a government exchange program, and subsequently, he never interfered. Transplant surgery was Dr. Nagpal's domain. Similarly, for endovascular, after we had a complication, he decided that he would not do it anymore, and he asked me to take over. Subsequently, he used to encourage us in every way, but he himself never stepped in to do any procedure himself. So he literally farmed out things. When Dr. Goel came, the CVJ was an area which he was very interested in. The craniovertebral junction was literally handed over to him. And of course, he did a wonderful job and he's one of the world authorities on CVJ today. Similarly, Ketan Desai wanted to do peripheral. I mean, he asked sir what he should do. So sir said, we are doing everything except peripheral now. You should do peripheral now. So he went for training to US and today he is one of the recognized surgeons for, countrywide for peripheral nerve and brachial plexus surgery. So not only did he support strongly the department itself, but he also supported so many departments in the hospital. And I agree with Dr. Ravi that we should have something in the institution which will leave its indelible mark for the future generations. Thank you.
I request Dr. Atul Goel to say his words.
With the demise of Dr. Sunil Pandya, KM has lost his most fantastic son. KM has become indeed very poor after we have lost him. KM has lost a crown jewel of a neurosurgeon, of a human being, which the corridors of KM has never seen and probably will never see. The way he walked, the way he talked, when he used to come from Assistant Dean Bungalow to the neurosurgery department in absolute white dress with shoulders high, chest up. When he used to walk, people used to get away from his path. Whether it was his persona or his personality or the awe that he created, the respect that he created. And then those people who talked to him, they were absolutely in awe and in great respect. Whatever he said was polite, was respectful, with dignity, with honor. He used to love human beings. He used to respect human beings. And God had given him a great opportunity to treat human beings like the way they should be treated. Neurosurgery has seen absolute heights in his days. KM was known for the hospital that it has, the people that he has. When I came to KM by chance, I was surrounded by giants. One of the giants sitting is Ravi Ramakant, Dr. Karapurkar, Dr. Lupa Mehta, and I don't want to take the names because we have come here to honor a giant of neurosurgeon. And Madam Pandya, absolute duplicate of Dr. Pandya. You know, same style, same kind of way of talking, same type of subtle arrogance, same kind of love and respect. I think, Nirad, my dear friend, you had a difficult time to deal with these giants that you had in your family. And I don't know much of you, but I'm sure you must be imbibing all that they had to give you through their lives. You, my dear Nirad, absolutely lucky human being that you were, we spent some time with him, but you spent a lifetime with him. I can only say God had given you that opportunity. God had given you that huge kind of situation where you could be with these kind of two people. He was not a normal human being. He was a Gandhian. Like Gandhi was not a normal person. You talk to Gandhi, he was some kind of a strange kind of language, strange kind. Similarly, Dr. Pandya was not a normal person. He was a gem. In the operation theater, I've spent a number of years assisting him. He was an absolute stylish neurosurgeon. The way he used to maneuver the microscope, the way he used to sit on the chair which he designed, the way he used to command respect, electrifying influence in the operation theater. Magical. You see, as soon as he entered the operation theater, the whole operation theater looked different. People who used to talk here and there, nobody used to have that kind of influence that he projected as soon as he came. And then you could hear only one voice, and that voice was of Dr. Pandya. Probably you don't know, he was the first neurosurgeon in the country who started microvascular surgery. He was the leader of surgery for aneurysms and AVMs in his time like nobody else in the country did. He influenced Dr. Karapurkar to become the father of endovascular surgery in India. He influenced Dr. Nagpal to become father of pituitary tumor surgery in India. And he has influenced a whole lot of generation of neurosurgeons who came from all over the world seeking his blessings, seeking his training, and were thoroughly influenced as soon as they were proponents and propaganda of KM Hospital. With the loss of Dr. Sunil Pandya, KM will never be the same again. Believe me. We will miss him, of course. And we will miss him dearly. KM Department of Neurosurgery will never be that shining jewel that it has ever been in the absence of Dr. Pandya. And for me personally, I have lost my teacher. I've lost my mentor. And if Niraj permits me to say, I have also lost my father. Thank you very much.
May I request Dr. M.M. to say a few.
I am a radiologist. My contact with Dr. Pandya was quite long, but recently I came in more contact with him because he asked me to write about history of radiology at KF for last 100 years. It's a great project. He helped me, he and Lopa helped me. They gave me all the information. And it's a really marvelous history. I think you will get it to read and you will appreciate the same. The efforts taken by Dr. Pandya to encourage me to write that. I have a very small poem which I thought I should share with you. Dr. Sunil Pandya, it's in Marathi. Dr. Sunil Pandya यांच्या स्मृतीला अभिवादन. सुनील तू, अमलिन तू, सुहृद तू, सुबुद्ध तू, आम्हा जनास बुद्ध ही तू. स्मितहास्य कधी ना लोपले, मृदू हृदय कधी ना कोपले, सान थोर शिकणाऱ्या अधिक काही गवसले, शल्यशास्त्र विकसले, प्रावीण्य तुझपती प्रकटले, प्रावीण्य तुझप्रती प्रकटले, शिकणाऱ्या सर्वांना सर्वांगीण घडवले. सरस्वती पुत्र तू, सरस्वती पुत्र तू, लेखणी देतेच साक्ष. इतिहास शोध तुझा बनून राही एक ध्यास. देवकीच्या कुशीत जन्म, ही वॉज फ्रॉम GMC. देवकीच्या कुशीत जन्म, KM यशोदा झाली धन्य. सॉरी.
Dr. Muzumdar.
Much has been said about sir. I need not repeat that, but when we joined neurosurgery, sir was almost at the end of his career. But after his retirement also, he continued to guide us. I used to seek his advice time and again when I was going to be in conflict. And his positive vibrations were always used to be healing. So apart from all the things that have been mentioned here, after a few years, when I remained in KM for 25 years, ascending through all the academic ladder, and he was impressed that the epilepsy surgery part, which was the fine part, which was remaining, took my interest in epilepsy surgery. He was very happy about it, and he used to always encourage that. And on every Guru Purnima, I used to sort of wish him, I should leave a small message. And that time he used to tell me that I'm not your guru, you are my guru. We have to learn from you now. That was something which was sudden and which was unexpected, and I didn't know how to react. We had the fortune of meeting him just 10 days before he passed away. And me and Dr. Desai met him for almost an hour. And that was serendipity. I don't know what happened, but some call came and we just met him. And I was really very sad to see him. And I know the way he was there. But I think his blessings will continue to shower upon us. And the main thing is innocence. I think his innocence, and he walked the talk. I wish that it is very difficult to practice what he preached nowadays. And I think with seniors like Dr. Nadkarni, who has also been my mentor, and I used to seek always advice from him, I think if we can imbibe at least 5 to 10% of his ethical values into practice, into real practice, maybe we have to take a back seat. I think that would be worthwhile. And as Dr. Ravi Ramakantan said, that I think we should try to name the Department of Neurosurgery as Homi Dastur Department of Neurosurgery. He has voiced this to us many times, but for some reason it has not happened. But I think Dean Madam will definitely take it forward, and whichever way it can be done, it should be done. Thank you very much.
Dr. Sarvinder Rai.
Actually, I was two juniors, and when I joined the Slok, I worked with professor for nearly 3 years, and I think he was a different personality altogether. Whoever came in contact with him, they all felt really nice and had a very good views about him. And the people could appreciate his behavior not by just because mere casual contact. Whenever he came, I know that the first thing one saw was that he always opened doors for other people. That is the first impression. He never walked out of the room until unless all the people had gone by. We many times we requested, and he had some peculiar things like he wouldn't let his job to be done by some other person, and he is a habit of doing many more things himself rather than living on. Many a times we were felt ashamed that he came for the rounds, but he used never bothered to let us know whether he was in the hospital. So actually, we had to track him down every time to be with him for his uh, rounds. And I really miss him, and I think he had a great vision, and he could see through what one would do and would transpire. And I saw that he appreciated all his fellow colleagues and even sent many of his patients who required specialized services, like somebody requiring endoscope third ventriculostomy at that point of time for some pineal tumor. So I think he sent to his colleagues also, and he appreciated highly about many different colleagues doing good in endoscopic surgery and appreciated and talked highly about them and had a good view. And importantly, at that point of time, I personally had no interest in open surgery, and I was keen on some functional neurosurgery. And uh, but he always insisted that since you did your endoscopy in general surgery, I feel that it would be more prudent for you to take up endoscopic neurosurgery, which seemed too far-fetched idea at that point in time. I really miss you, sir, and I think.
Dr. Lahiri.
What I could not learn at my teaching institute, I was able to learn it from Dr. S.K. Pandya. That is a virtues art of living. If you want to learn the art of living, you don't require to go to great acharyas and the great philosophers. I think so. We had in front of us exemplary Dr. S.K. Pandya. I met him in the little late stage of my life. If I wish I would have met him at the age of 18. What a commitment, uncompromising in the principle. And as Atul said, upright, but are not upright in the posture, upright in the virtues, ethic. I think so. And ethic is most relevant today in the 21st century. When people describe the ethics, Hippocrates, I think so, it is much more relevant today. And Dr. Pandya, I think that there are, unbelievable thing we have learned from him. And I was stranger to him, but he was so generous to me. He arranged a place as well as the donation for spine surgery setup. Today it has grown into a very good place with the robotic surgery facility and everything. So I think so, Dr. Pandya, I so feel that it was my best institute, my teaching institute where yes, okay, it has trained me, but I think so, person who has not learned the commitment, ethics, or the way of Dr. Pandya was a great example that you can learn the art of living. And I'm sorry that I am a bit late, but still, if we explore his career and his this thing as a, I wish as all these neurosurgery people who had a privilege. One day, I asked one more gentleman, Dr. Sultan Pradhan, how all the people who are trained in the neurosurgery department, that is Dr. S.K. Pandya, Swami Dastu Saab, and sending order all the people. I think it was unbelievable. So yes, now the medical education, medical ethics, unparalleled. Thank you.
Dr. Alok Sharma.
Looks like God is getting lonely out there. So people like Ratan Tata, Manmohan Singh, and Dr. Sunil Pandya, all of them have been recently called up. And what Ratan Tata was to the industry and Manmohan Singh was to the finance world, I think Sir was bigger than that in the field of neurosurgery and medicine as a whole. A lot has been said, so I'm not going to repeat everything, but just a few things. One to Dr. Sangeeta, I reinforce what Dr. Ravi said about naming Janus, the museum, after Dr. Sunil Pandya. The reason is that Dr. Pandya, Dr. Manu Kothari, and myself, three of us, I was a resident in neurosurgery, we three created that museum. The word Janus came from Manu Kothari. Janus, because Janus is a Greek god that looks ahead and back at the same time. So that's why January is named after Janus. Me and Sir, Dr. Pandya, have gone to the basements. We've gone to the cardiology department and took out the first ECG machine. Went to the AK department, took the first. We physically went and got all of that. So having been personally involved, if we can just name it after Sunil Pandya, it would be wonderful. That's our request to you. He was obviously a great historian. I remember one Sunday at 7 o'clock in the evening, on the rounds, he says, "Can you come with me right now? We have to go to Dr. Ram Ginde's house." And what happened, his wife had called, they were relocating, and she had said, "There are all his books available. But if you come and take it today, we can give it all to you." Okay. So he, me, one of our colleagues, and we took an ambulance, took bed sheets from the operation theater, carried bed sheets, took all Dr. Ram Ginde's books, and there were several hundred of them. Historic books. I remember the first edition of written by Dr. Parkinson, the movie Shaking Palsy. That was one of the books. So he was, of course, very much into history, and I've been personally involved with that part of him. What also people don't know was that he was very much into technology. The first computer to come into KEM hospital actually came to the neurosurgery department. We were housemen that time, along with the first computer. I'm talking the late 1980s. And so he was very much into technology. There was a small room where he had a computer, and we used to sit there. And if there was a program, he would do something very interesting. If there was a program, you had these software programs. He would take the book and do it from beginning to end. He understood software right from the beginning to the end. So he was very much into technology. And another very interesting thing most people know is that he used to walk a lot. So my later interaction with him, there's a close friend of his, Satish Kulkarni, who's a printer. I had introduced them. Every Sunday morning, he would walk from Marine Drive to King Circle every Sunday morning till, I mean, not the last few years, but before that, and then have idli at Madras Cafe. And, you know, I had some interaction then, idli at Madras Cafe, and then sit with Satish Kulkarni and hunt websites. They would just go, you know, just go into what are the new website, and he would get a great thrill out of discovering a website nobody knew before. It was like a child. You had to watch him. He would just enjoy it if he discovered some interesting website. So there was a little child in him, a historian in him. He loved the technology part. And talking of clinical, there's something he used to do which I don't think happens anywhere in the world today. From the beginning to the end of a patient care, Dr. Nagpal, Dr. Karapakar would be personally involved. For example, the neurosurgery OPD was the only OPD where residents did not sit. Only senior professors sat, and he used to see the patient personally. His notes were so immaculate. The way he wrote it, you know, lovely handwriting. It was like telling a story. So he saw the patient personally in the OPD. The imaging X-rays, there used to be at 4 o'clock, there used to be a imaging session where he used to dictate every angiography, he and of course our other two teachers. So the imaging was dictated personally. In the operation theater, from preparing and draping, from the skin incision to the closure to the dressing, he always did personally. In fact, he would tell us to go out and he would dress and come out, and always wrote the operation theater before leaving the house, wrote the operation notes, and operation notes were such beautiful to read. It's like a story. If you saw it, you could almost visualize what happened. And of course, God forbid something went wrong. And also rounds, yeah, 9 o'clock in the morning, one of the three professors, 9 o'clock on the dot, they would take a round. I don't think this happens anywhere in the world today. This whole thing from beginning. And like I said, if God forbid something happened, there was the brain cutting sessions with pathology, which he would personally be there. And his interest in that, in every small thing as to what went wrong, was so deep. So right from seeing the patient to the first time to ensuring that everything went well with the patient, operating from beginning to end, and the brain cutting, the commitment to the patient was absolute. We will missing. They don't make people like that anymore. And he was a great man. All we can do is learn his lessons. And to Dr. Sangeeta, if we can just name the other thing about Dr. Dastur, I think that's a great idea as well. But at least Janus, because he and me have gone into basements and dug out all the equipment from there. So it'd be lovely to name it after him. Thank you.
So there remain.
To speak a little about SKP is actually as little as I can speak, is actually you can write or think volumes. So the first thing that we joined KM in 95, the first thing is impression. So the impression was when we heard the name SKP, who is SKP? So SKP was the man who was idol of two of the most influential people at that time in KM, DRK and Ravi Ramakar, who themselves have gone to inspire thousands of people in their branches and elsewhere. So just to see him, a colossus of a man, and then to work with him was fantastic. So for such a big man in neurosurgery office, any random phone call that would come, he would pick it up himself And he would say, neurosurgery, this is not about saying hello, this is not about Dr. Pandya here. He would say neurosurgery. That office did not have his or the other two eminent professors' name outside. It was neurosurgery that was written outside. And to go to that office, I don't know, I've not been there for quite a long time now, but full of books and the most beautiful, beautiful smell of fresh coffee. So I would go there in my very junior days after lunch, because that was the time that he would report. And one of my friends, Ashish or Ketan, would have to sit and write those reports that he is going to dictate. And standing behind him and looking at the image and trying to see what is he looking at and what is he reporting. So the routine things about the patient's names, dates, and what was done. CT scan, KM didn't have a CT those days. CT or angio done somewhere, 3 out of 4 times. The first thing that is written, CT scan, that at Bombay Scan Center. The first sentence, poor quality. So I didn't know that what it meant. So later on, I went and asked Ketan that, did you really write this? He said, yes, he has said it. So he was like that. Say it like you see it. But the thing which I have to say here is after Karapurkar sir went to Delhi in 1996, he said that the department, we used to call it NST those days, the department will be managed by Uday Limay, a greenhorn, under supervision of Ramir Makan. And that's how I must say that in a world which is highly polarized today, there was just one man who was above it all, and that was SKP. Thank you for everything.
Dr. Bhavna Takalkar.
It's very difficult to talk about the teacher. In the name, I'm Bhavna, so I'm equally emotional. I happen to be his first female resident of neurosurgery. And what we see in today's era, it was such a warm welcome, such a fatherly, no discrimination. And I had the privilege to be with him. If you learn something from him besides neurosurgery, it is already said, art of living was also the honesty and transparency and the administrative skills. If something went wrong, he was with the. I was so surprised when he said, it was my mistake. I did it. How many times you hear the professors saying that? And that's a big impact. Then teacher. He retired in March and our exam was in June. He came all the way from Jaslok to take our clinics. I was pregnant at that time and Jaydev just told sir ki Bhavna cannot travel by local, sir, can you please come in the department? And every Sunday he came to the department to take our clinics after retirement. This example as a teacher, the commitment as a teacher is just impossible. And one day he was late by 15 minutes. He called up the department and said, I'll be late by 15 minutes for the clinics, which he was doing voluntarily. He was traveling all the way from Jaslok to take our clinics. These teachers, this kind of people are impossible. Thank you.
Dr. Rohidas.
very difficult to talk about teacher because of whom I am here. I got my name about in the medical faculty of endoscopic spine surgeon is because of him. I first met him in 1983 when my sister had conversion and she was took the KM. I was in second, third. So I had seen all Dr. Nagpal, Dr. Pandya, and Dr. Karapurkar at that time. And at that time, I decided that I will do neurosurgery. During my MS training, I had training of all plastic surgery, urology, gastroenterology, everything. Cardiothoracic surgery also. And I had in my mind about neurosurgery. So I came in 1989 to the Department of KEM. Actually, I fought with him because I wanted my teacher to be, PG teacher to be Dr. Karapurkar. But by the seniority, Nikhil Shah got Dr. S.K. Pandya. And then I was the student of Dr. Nagpal. But he gave me topic of Dr. Karapurkar, transferal surgery for dissertation. I left KM in 1992. I joined in 1988, 1992. I started my practice because of the KEM training. I could start immediately at Kolhapur. And after 10 years, in 2002, when I thought of getting training in endoscopic spine surgery, everybody was skeptical. ऐसा नहीं होता है, endoscope से नहीं होगा, endoscope से ये नहीं होगा. Only Dr. Pandya told me that, look, rather than thinking about it, you go to that person, see what he does, try to have a look at what he does, and then make up your mind whether it is good or bad. So I went there. I initially wanted to go there for about a week or so. I stayed there for 2 months. When I came back and I met Dr. Pandya in Just Look, I showed him a CD about what my teacher, Dr. John Distandu, was doing. And then he told me that, look, this is possible. This is what we never thought of it. And then it succeeded. I'm one of the luckiest students who got opportunity to operate the teacher who has taught the student about the basics of the surgery. That was in 2011. I invariably used to talk with him about the surgeries, my progress. He used to refer patients to me sometimes in Kolhapur. But I'm deeply in sorrow because of my teacher who has taught me the honesty, the ethics, which I'm following since 1993 when I started my practice. I still remember he used to give patients money to go to the CT scan center by an ambulance or by a cab. I have followed that in my practice. In my 30 years, I have never said a patient no because he doesn't have money. I can do it free because it's my own hospital. This I am able to follow because of my teacher, Dr. Pandya. We call him at SKP, RDN, and APK.
Dr. Samkhe.
Good afternoon. I'll actually start off by an incident. This was when I was a resident in the Department of Neurosurgery with the three bosses, that is SKP, RDN, and APK. And we had a patient who was actually placed in the side room because he was then found out to be HIV positive. Sir said he would do the case himself and no one would do it because he believed very much that if there is anything which is difficult and any responsibility which had to be taken, it would be him. And it so happened that in the confusion, for whatever reasons it was worth, surgery didn't go well. And it was realized that we landed up operating on the wrong side. Now, what happens next? The sir came to the wards, and I was the first year resident in neurosurgery, just post MS. And sir said, Dr. Sankhe, please come. We have to go and talk to the relatives. And here I'll land up shivering, not knowing what has happened suddenly, because by then I had heard that this has happened. So he told me, explain to them that this is what has happened. And he tried to explain to them in his, broken Marathi. The patients were Maharashtrians. And at the end of it, he told them that, look, this is what has happened. Unfortunately, your patient is fine, but this is what happened. We have operated on the wrong side, but it doesn't matter. If you're okay with it, I will give you the name of the lawyer who can sue me. If you don't have the money, I will fund it for you. Go ahead and do what you think is necessary. But if you're okay with it, and if you agree with everything, we are happy for me, or if you want any other colleague to come and operate, to operate on the correct side, and we rectify the situation tomorrow. Why do I describe this story? This just reminds me of the fact that he was not only honest to the core, but that integrity to tell the patient and his relatives that I've done something wrong. And if you need help to try and correct it, or for that matter, even file a case against me, I'm up for it to tell you and to support you just because I've made a mistake. What does it do? It just left a lasting impact for everybody of us. I don't think I have ever met anybody who's going to accept a mistake so honestly in front of the patients, telling him that I made a mistake, go ahead and sue me, or I will fund your money, whatever is required, and everything as such. My first interaction was very much in the MLT on this. For everybody who's been of MBBS, MS, and MCH student in this institute, they would have all experienced that your course starts off with an introduction with the Manu Kothari Sab and Lopa ma'am. And the highlight of the anatomy classes would be the lecture which would be taken by SKP. It would be a full 1 hour lecture, and this MLT, which is just on the level below, it would be completely packed. And here he would just make sure that everybody is just spellbound completely to the awe of not only the way his personality was, but the way he actually encouraged people to, understand anatomy. Manu Kothari used to always say that the nerves come first and the bones come later, whereas here this gentleman would say, look, this is something which starts just with a few cells, and here you have an organ which is just not understood. So that's what everybody learned. Luckily for some of us, we had the opportunities, as has been described by many, including Alok, Rohidas. We used to spend a lot of time learning radiology. Some of our most, very, very, preserved memories have been the memories of writing down those reports. We would all sit down in that office. It would be a real learning time when Sir, either Dr. Pandya or Dr. Nagpal or Dr. Karapurkar would actually give us those sort of dictates those reports. And it would not be necessarily only neurosurgical. They would report only all those x-rays as well. Even the chest x-ray which was done for a patient would also be reported by Sir. And this would just go down to, tell us that read everything that comes your way. Just don't read only the MRI scan or CT scan. And, just as everybody was saying that, many of them have actually grown because of his guidance. We saw that happening with Dr. Nagpal and Dr. Karapurkar were professors, but we saw it happening with Dr. Atul Goyal. We saw it happening with Dr. Ashok Hande when he went on to do aneurysms, taking over from Sir. Then we saw that with Dr. Lahiri. We were actually students that time when Dr. Lahiri was actually encouraged to come to the Department of Neurosurgery to do spine. So when I was actually moving out of the department, I asked him as to what would I do, and he said, why don't you just stick to doing something which is not practiced or things like this. So I came back a year later. I had moved on to England by that time, and I came back and I said, sir, I'm thinking in terms of moving into functional side. And he was so keen that when I wanted to come back and I asked him, sir, can I actually move into Just Look? And he said, no, don't come to Just Look. There is a place which is moving in at Hinduja. Please go to Hinduja because that would be the place for you. So thank you for all the guidance, and thank you to sirs as well, and all the seniors who are around. Thank you very much.
Sister Sindhu Chaugule.
Good afternoon to everyone. Today we have gathered to remember and honor Dr. Pandya sir. I extend my deepest condolence to Sir Pandya and his families and close friends. My heart goes out to you during this incredibly difficult time. Almost most memories are there, which few I'm going to share here. When I have completed my diploma in nursing, after 1 year, I joined the neurosurgery department, operation theater. And the sisters, because I belongs to this profession, nursing profession, so I will talk little regarding that. 2 sisters were there. They were very strict because that was the requirement of the department. And it was the posting like torture or jail posting for the nurses, because the sister was very strict. So after finishing my month May leave, I was posted in neurosurgery OT. So the environment was very tensed inside the OT. Strictly, we use means like we were not talking with each other. Only you have to work. That's all. And at the end, you have to go. Half an hour you will get. With that, you have to finish everything, whatever leisure time or food. And continuously, one has to complete the case. Like that it was. Means one nurse will complete the case. If she will finish her duty, then somebody will come and relieve. Otherwise, there was no relief in between the case. So mine was 2nd month, and the sisters, means they were going to retire. One sister got promotion and other one was. Even sir was also around 50 plus, no, that time, because I joined in 1991. So he must have think that to not only to requirement of the OT is not only the surgeons, but also one has to strengthen the knowledge of the nurses. Then only the department will run smoothly. So that was my luck, or maybe. But sir has given me opportunity to do this training. So I have completed my training, diploma in neuro nursing at Nimans. Then so I successfully completed it, and I served under his guidance, and it was the turning point in my career and even professional growth. So I am profoundly grateful for his belief in me and the doors he opened. His positivity, work ethics, attention to details, and human values were truly inspiring. Sir was known for his incredible kindness, always ready to lend a hand or offer a listening ear. He had a way of making everyone feel valued and loved. I am deeply grateful for the time I spent with him and the lesson he taught about resilience, compassion, and integrity. Though may no longer Sir is being with us in body, their spirit will live on in our hearts and memories. The lesson he imparted and the love he shared will continue to influence us all. Two memories I will share. These sisters were got retired and the new sisters were joined. And those days, washing day was not been given, but first time it was given. So cleaning, everything was done. The mounted mounted काय हे केलेलं आपले mounted cauteries, because I am now in other department, so I have forgot. So mounted cauteries were there on the ceiling. Sir came, we called sir. Sir came, he entered, he looked everywhere. Then he had just slid his finger on that mounted because it was up and it was not been used. So that dust was there. So he had just shown that. So with that, his observation, keen observation, that is been appreciated. Then second thing, when he used to enter in the operation theater, wherever the small piece of gauze or whatever, it is been fallen, he used to pick up and dispose it. So everybody was on the toe when sir used to enter, and exactly at 8 o'clock, we used to take the patient. And even now it has been little bit changed, but if we want to enter out the OT, we have to change all the OT attire, and then only we have to come to whatever you want to do. And these slippers, inside, outside, everywhere, it was strictly been seen. Okay, and everybody used to follow those things. So there was infection rate was, we can say, very, very minimal. And with the small antibiotics, what we require nowadays, a little bit higher, but that was enough for the patients to heal. So thank you, sir, for everything. You are the mentor in my life, and you have means professionally, because of you, I could grow. Thank you very much, sir. Thank you.
Dr. Nitya Gokte would like to talk on behalf of Dr. Nilima Shivsagar.
Good afternoon. I'm reading out this message from Dr. Nilima Shivsagar, who is out of country. Dr. Pandya was the most supportive research collaborator one can ever get. Dr. Pandya and our clinical pharmacology team, with DBT funding, and Dr. Bachawat, developed the liposomal amphotericin B. He helped at every step, right from writing the grant proposal to negotiating with the dean to get space for a sterile room facility and placing his faith and trust in the liposomal amphotericin B produced in our own laboratory and giving it to his own patient. He was by our side when we were injecting the product into the first patient in the medical intensive care unit with Dr. Dilip Karnat. He reviewed his patients daily as Aspergillus, and on the ward round, he discussed with me as to how to assess the effect of liposomal amphotericin B. After all this, with a smile, he would give the entire credit to clinical pharmacology. It is over 30 years that the liposomal amphotericin B was developed under his guidance and critical review. It has been marketed and has been of great value in patients of mucormycosis during COVID, as well as patients with Kala Azar. It has saved lives of patients, his patients, and so many others. Our joint paper has over 120 citations. His contribution will be remembered. Dr. Pandya, Om Shanti. Just take one more minute. I was a first-year resident in pharmacology, when the liposomal amphotericin B was made. I was a nobody. Somehow, Sir kept in touch with me until a few months before his demise. And I came to know only in the last 6 months that Sir was extremely fond of me. So let me just close with this, something that I really like from the Brihadaranyaka Upanishad. Asato ma satgamaya, tamaso ma jyotirgamaya, mrityo ma amritam gamaya. Om Shanti, Shanti, Shanti.
We conclude the condolence meeting of Dr. Sunil Pandya and pray for the departed soul. Actually, I'll read a message which has been sent by Dr. Supe. Dr. Sunil K. Pandya, a luminary in medicine and medical humanities. It is with profound sadness and a deep sense of loss that I reflect on the passing of Dr. Sunil Pandya, an extraordinary neurosurgeon, mentor, and a pioneering force in medical humanities at KM Hospital. His departure leaves an immense void in our medical community, yet his legacy continues to illuminate our path forward. Though I was never formally his student, I learned immensely from him through various forums and personal interactions. As the founding chair of the Humanities cell at KM Hospital, Dr. Pandya envisioned medicine as an intricate blend of science and human experiences. He believed that truly effective leaders embrace both the technical precision of medicine and the compassionate understanding of healthcare's human dimensions. Under his leadership, the Humanities Cell became a vibrant hub for intellectual discourse, ethical reflection, and the cultivation of empathy in medical practice. Dr. Pandya was not just a senior colleague and teacher, but also a mentor whose wisdom profoundly influenced me. He approached ethical dilemmas with a rare blend of intellectual rigor and deep humanity. Almost every day, he shared his wisdom mail, a treasure trove of articles, thoughts, and life lessons that enrich all who receive them. Whether discussing complex cases or addressing systemic healthcare challenges, he consistently emphasized the importance of maintaining a strong moral compass against the complexities of modern medicine. As the head of the Department of Neurosurgery at KM Hospital, Dr. Pandya's contributions extended beyond his surgical expertise. He fostered an environment of excellence where young doctors were encouraged to question, learn, and grow. His department became a beacon of clinical expertise, ethical standards, and humanitarian care. What truly set Dr. Pandya apart was his ability to bridge the worlds of clinical practice and medical humanities. He understood that the finest doctors are those who combine technical mastery with emotional intelligence and ethical awareness. Through his countless discussions, lectures, and personal interactions, he shaped the perspectives of generations of medical professionals. As the current chair of the Humanities Cell, I feel a profound responsibility to carry forward his vision. Dr. Pandya showed us that medicine at its best is both an art and a science, with humanitarian values are as essential as clinical skills. His intellectual legacy continues to inspire our approach to medical education and practice. Today, while we mourn his loss, we also celebrate a life dedicated to advancing medicine and medical humanities. Dr. Pandya's influence lives on through the countless lives he touched, the department he nurtured, and the humanitarian ideals he instilled. His passing reminds us of our duty to uphold the principles he championed: excellence in clinical practice, unwavering ethics, and compassion for those we serve. May his soul rest in peace, and may his ideals guide us in our pursuit of medical excellence and humanitarian care. We will miss you, sir. Dr. Avinash Supe, Chair, Medical Humanities Cell, KM Hospital, Mumbai.